Imagine being told you have a brain tumor so aggressive that it's considered one of the deadliest forms of cancer. That's the hardest reality of glioblastoma, a condition that affects thousands of families here in India. Today we are diving into everything you need to know about glioblastoma, what it is, how it develops, the current treatment landscape in India, and the real life case that shows how difficult it is to fight this disease. Glioblastoma or GBM is the most aggressive form of the brain cancer. It originates from the glial cells in the brain which are responsible for supporting neurons. What makes glioblastoma so dangerous is its rapid growth and the way it invades surrounding brain tissues. In India, glioblastoma is the most common and aggressive type of primary brain tumor, accounting for about 50% of the primary brain cancers in adults. Unfortunately, the survival rate is extremely low even with the treatment. The average survival time for the most patients in India is around 12 to 15 months despite surgery, radiation and chemotherapy. So how does glioblastoma form? It's considered a primary brain tumor, meaning it originates in the brain rather than spreading from other parts of the body. The exact cause of the GBM is still unknown, but certain factors can increase the risk. Age. It's more common in adults over 50 years old, but cases in younger adults are not unheard. Radiation exposure. People who have undergone radiation therapy for previous cancers have a higher risk. Genetic mutations. Though rare, some hereditary conditions like Leaf-Remuni syndrome may increase the risk. In India, like in many other countries, most cases appear sporadically without a clear reason. Glioblastoma often presents with vague symptoms at first, which makes it hard to catch early. These include headaches, seizures, nausea, memory loss, or behavioral changes. However, as the tumor grows, these symptoms worsen, leading to the neurological complications. When doctors suspect glioblastoma, they order an MRI scan, which typically shows a mass of ring-like appearance, what we call ring-enhancing lesion. But to confirm the diagnosis, a biopsy is performed where a piece of the tumor is taken and analyzed. This is the gold standard for diagnosing brain cancers in India. Now, let's talk about treatment. Glioblastoma treatment in India follows global protocols, but access and affordability can vary across regions. The standard treatment involves three main components: surgery, radiation therapy, and chemotherapy. Surgery. Neurosurgeons aim to remove as much as tumor as possible. However, due to the way GBM spreads into healthy brain tissue, it's impossible to completely remove it. Radiation therapy. Following surgery, radiation therapy is used to kill any remaining cancer cells. Chemotherapy. The most common drug used is temozolomide, which is available in India. It is taken orally and is used to reduce the risk of recurrence. In India, especially in the government hospital, these treatments are available, but there are challenges with access, cost, and follow-up care. Even after aggressive treatment, glioblastoma often occurs, making long-term survival a challenge. Let me tell you about a case from India. A 52-year-old man named Arun from Nagpur came into the hospital with severe headaches and confusion. His MRI scan revealed a glioblastoma in the left temporal lobe. Despite his age, he has no previous health issues and lived a healthy life. Arun underwent surgery to remove about 70% of the tumor. Post-surgery, he was put on radiation and chemotherapy. For the first few months, his condition improved. However, after 6 months, the cancer recurred aggressively, spreading to the other parts of the brain. Unfortunately, Arun passed away 14 months after the diagnosis. His story is not unique. Across India, countless families face the same devastating news. It shows how relentless glioblastoma is, even with the best treatment available. So, what's the future of glioblastoma treatment in India? Researchers here and around the world are constantly working on new therapies. Immunotherapy is showing promise by helping the immune system fight the tumor more effectively. Gene therapy and targeted therapies are also areas of the active research. While those treatments are still in the experimental stage, some are being tested in the clinical trials right here in India. Another treatment showing promise is tumor treating fields, which use electric fields to slow the growth of the cancer cells. While these treatments are not yet widespread, they offer hope for the future. Glioblastoma remains one of the deadliest cancers we face today, but with the continuous research and new treatments on the horizon, there is a hope for future patients. In India, we are fortunate to have access to many advanced treatment options, though challenges like cost and accessibility remain. If you or loved one is affected by glioblastoma, know that there are resources and support groups available across India. And as always, early diagnosis is a key, so don't ignore persistent headaches and neurological symptoms. I hope this video has helped you understand the complexities of glioblastoma, its treatment, and the situation here in India. If you found this video helpful, make sure to like, share it with someone who might benefit, and subscribe to Med Insights with Rahul for more deep dives into the world of medicine. Stay informed, stay healthy, and let's work together to push the boundaries of medical knowledge.